Now, after an inaccurate prediction by the WHO led to a relatively ineffective flu vaccine this winter, the Health and Welfare Ministry had suggested it would offer a more comprehensive free flu vaccine in the next annual cycle. But a conference of professionals reached the decision yesterday not to upgrade the free shot and to continue with the same type of trivalent vaccine in the next flu season.
Last year, the World Health Organization's prediction about which flu strains would be the main threats turned out to be wrong. That meant the trivalent vaccine on offer in Taiwan was not as effective as it should have been, leading the Health and Welfare Ministry to say it would provide more comprehensive cover this year with a quadrivalent vaccine. But that plan was scrapped yesterday.
The
state's financial resources are limited. The budget for vaccines is limited. We think the top priority should be preventing the diseases that cause the greatest harm to the public. The quadrivalent flu vaccine is still our third priority.
Dr. Lee Ping-ingNTUH was at the meeting for medical professionals yesterday and admitted the decision was due both to budget issues and to the fear that Taiwan couldn't get its hands on enough of the quadrivalent shot, global stocks of which are lower than those of the trivalent shot. The main difference in the two vaccines is that the quadrivalent covers both major lineages of the type B flu virus, whereas the trivalent doesn't cover the Yamagata lineage. Plumping for the quadrivalent would approximately double the cost of the operation for the government.
The trivalent vaccine does confer cross-protection for all type B flu viruses. It may be a different lineage from the main one circulating, but that doesn't mean it's completely ineffectual.
The CDC points out that despite the WHO blunder on the vaccine last year, there was no major epidemic of type B flu in Taiwan as some had feared. New figures from the US and Canada also suggest the quadrivalent vaccine only has a success rate of 40 to 50%, little different from the 30 to 50% protection afforded by the trivalent.